Welcome to the Adventures of Alcaraz podcast. My name is Julian Alcaraz.
And I'm Miranda Alcaraz. And we are halfway.
Yeah, 20 weeks.
20 weeks tomorrow morning, technically. Yeah, halfway mark.
This was a good week. I mean, we got to see our baby boy.
We did.
You
got to see him and you got to feel him.
I did.
On the same day.
That was very special, actually. Mm-hmm. And that was early on this week, so that was kind of nice.
Yeah, so for those of you that are just going through this or you've never been pregnant before, right around the 20-week mark, and it's different how many ultrasounds you get. We've talked about that a lot, depending on where you live. When we lived in California, we saw Knox every time we went to the doctor. This time, we hadn't seen baby B since my 6-week ultrasound, so for like 14 weeks. But pretty standard practice wherever you are around the 20-week mark, they do what's called an anatomy scan. And it's a really long ultrasound where they're looking at like their brain and all their organs and their eyes and their stomach and their kidneys and the blood flow and the umbilical cord, like everything.
It was pretty wild to see that. And the cool thing is that when we went in there, he was in such a good position that the ultrasound was smooth sailing.
Yeah, so first of all, he was very active, and the lady was like laughing. Yeah. She was like, it was at 8 o'clock in the morning, so we're for sure her first one of the day.
Yeah.
And she's like, this is way more exciting than any of the ultrasounds I did yesterday. And she was like laughing. He was moving around, and he would turn his head and look, and then like you could see on the ultrasound where she was pushing into my belly. Like you could tell where it was like dipping in a little bit, and he would like touch it. And like at one point it looked like he was like kissing it, and it was really funny. And Knox was the same way when we had ultrasounds with him. He was always really funny in there. We felt like.
Yeah, we were a little worried because we're worried that we're gonna get another hyper wild boy like Knox is right now.
So hyper.
And because we're scared of the sleep. Who knows how that's gonna turn out? But as he's in there now, he's moving around and partying it up.
Yeah, he was going wild, and he was like kicking and moving his hands and stuff. It was really cool. But yeah, they go through, and they did let us film some of it, so it'll be on the vlog that comes out early next week. But you know, they go through and they kind of. I don't know how any of it works. I don't know how they do this. I don't understand the technology. But they measure like his whole body. So they told us that he was 11 ounces and 12.9 centimeters, I think. Yeah. Is what it was, which they had me at the time 19 weeks, 3 days, which is exactly how far along I am according to my due date, which is great. And then they measured, they looked at the 4 chambers of his heart. That was really cool to see.
It was just, I mean, everything, right? His arms, his legs, his little heart, his lungs. They really, I don't remember this thorough of a scan, or who knows. It just seemed a lot shorter with Knox the first time around when they did this. This one was long. It
was like an hour long. However, it was like an hour long. When I came into the office later that day and I was telling one of our workers here, Carolina, who just had a baby 2 months ago, I was telling her, it was long. It was like an hour. She said, oh my gosh, my anatomy scan was 4 hours long. Like they had her leave, go eat, and come back because I think that they have a checklist that they pretty much have to check certain things off. And if the baby's not in a good position...
It makes it really hard.
So the only issue that they had with this baby was he was in like almost like the bottom of a squat. And when they went... He wasn't like that the whole time. But when they needed to measure his leg bones, he was. And he was chilling and he wasn't moving anymore. And so they like had me go pee and come back in, and he was a little bit better, and they were able to get it. But... especially for the organs and stuff like that, if they can't get to it because the baby's in a weird position or whatever, I guess they she had me lay on my side for a minute to see if he would move to get his legs. So I can't imagine what 4 hours looks like. And I don't know how common that is, but I know they do have to see certain things or they'll have people come back.
Yeah. How did that feel for you, getting to see him on the screen?
I mean... to be honest, when they gave us the profile pictures, because they did print out some of the images, the profile looks like Knox to me.
Yeah. Kind of
but it's a baby skeleton, like like they don't have a lot of fat on their body or in their face or anything. So how different could it possibly look? But he has like the cutest little profile, and then just, I mean, people will say your baby doesn't have a personality till they're like 6 months old. I don't agree with that.
No, he's definitely.
Knox's personality has been his personality since the moment he was in my tummy, because he was wild the whole time. And since the moment he came out, I mean, his facial expressions are literally no different today than the first photos that we took of him. He looks exactly the same, just older.
Yeah.
And so I feel like that starts to develop even early. So it's fun to see them moving around and stuff. It was really cool. Obviously, you worry that there's going to be something wrong in there.
Yeah.
For us, the only thing that they said was they were measuring his stomach, not the circumference of his abdomen, because that's a different one, because I've talked to some ultrasound techs since then. Of course, anytime I post anything, we have at least one street parking member that does this for a profession. So there's an ultrasound tech street parking member who she thought when I was talking about this, it's his abdomen circumference. It wasn't his abdomen circumference was normal, but his actual stomach, like the organ of his stomach, I guess was was full.
Yeah.
And so I do have to go back to make sure that that's not always the case, that he just had swallowed some fluid or something, which is normal. But they want to make sure that whatever fluid that he's swallowing is passing through his body and not getting stuck in his stomach because there's something wrong with his like digestive system, his intestines or whatever.
Yeah.
So the doctor came in and she said that it's super common to have people come back for that, and it's very rarely like anything to worry about. But obviously, again, they have to check all those boxes. We were just kind of excited that we get to see him again.
Yeah, that absolutely. So we get to go back later this month. I think like in
December 30th.
Yeah.
So in like 3 weeks from Monday. Yeah.
Oh, that's awesome.
But yeah, it was really great to see him, and I don't get so interested. I mean, I do think it's interesting, like the science and everything, but mostly I just enjoyed
Just watching him.
Yeah.
You just enjoy watching him for the hour that we were in there. That was It was really cool getting to see him and have formation as opposed to last time where it was a dot.
A dot.
Right. And now, yeah, that was really special.
How was it for you?
Yeah, it was really special. And then, like, kind of getting in the truck, realizing, wow, like, after seeing how active he was in there, tying it to, like, well, maybe he's just going to be another wild little boy, just like Knox. And then we're going to have two of them. And then it does get me excited knowing that two little buddies.
Yeah, and then we went home, and we showed Knox the photos, and he knew right away what it was.
Yeah, he knew right away. That
he
was
said
cool.
his name, and every time I show him the photo, he says it's his name, and it's so crazy.
It's pretty special.
Yeah, it's he still talks to him a lot, and he still high fives him, and he'll tell him good job after the workouts and stuff now. But it was really special to see, and I don't know. I know we talked about how last time the ultrasounds are what made it really real for you. Also, during the ultrasound, he was moving so much that I had my hand on my belly when they had gone out to like get the doctor to come in to talk to us. And I could tell he was still moving, and I could feel a few little kicks on my hand, which had only happened really like a day or two before that. The rest of them I could feel, but you couldn't like feel it with your hand. And I hurried in and told you, and you felt him while we were there in the ultrasound place.
And, from here, this point moving forward, I just know that it's going to get to a point where you're going to see his hand and his little feet just move around on your stomach. It's going to be quite interesting. That's when I get to poke him back.
It's going to go so fast.
Yeah, it is. I mean, we're halfway done, and the first half has kind of flown by. I mean, I know it's a little different story for you guys because, like, you're...
Yeah, I would say that it has. I mean, like, when I think about... Because we're so busy always in December and January for just the nature of our business... that, I mean, the due date's 4 months from Christmas Day.
Yeah.
That's like nothing.
And then January is busy. February we travel. March we travel. And then in April, that's when he's supposed to be here.
Yeah.
Yeah. Yeah. Those are all pretty exciting things.
Yeah, the only I've been really tired this week.
Yeah.
Really tired, which I haven't really had that. I'm like almost halfway through the second trimester, and usually, you know, the second trimester is known as like the easier one where you're not as tired, but this week I've been really tired. I had a bad dream one night, and then I like slept where my neck was bothering me the next night, so I know that has had a little bit to do with it, but
part of it too is just like we have stressful things. Like this week was a very stressful work week in general, internal stuff, but that definitely adds to it, you know. But overall, it's been good to see you feel great.
Yeah.
Yeah, it's been really good to see you feel great about everything.
Yeah, it's good. I think I had like a little sense of relief coming home from Thanksgiving because we don't have another trip planned until February.
That's really nice.
So
too,
it's like a couple months of being home.
Because Knox has gotten back into this like sleep routine where he does wake up after 7. Because for a while he's waking up after the time change and everything. He's waking up at 5:15, and that was rough, right? Because that was just a lot of hyper at once, and now he's gotten into a good flow. So that's something that I kind of wonder about as the baby gets here. How is that going to affect Knox? That's very interesting, and a lot of adjusting and adapting.
I mean, we're talking about Knox, but I was thinking this morning, Knox is so loud when he's awake.
He's loud.
That it's going to affect the baby, because you went down and you were downstairs with Knox this morning. I was still in bed. And if the baby was in there, I don't sleep. Once you're awake with Knox and downstairs, I'm still like in bed, but I can't go back to sleep. He's not like, he doesn't like scream or anything, but he's just like, so he's just a loud talker, I guess.
Loud talker.
And he talks so much that it's going to affect the baby too, because Knox is a very loud talker.
Yeah. I feel like he's going to be, from the videos that my mom's been sending us and just how he is in general, I feel like he might be a very assisting brother.
Yes.
He's just going to be like, here you go, baby, here you go.
Yeah, we're going to have to teach him quiet voice.
Quiet voice, absolutely.
Because right now we don't really have a need for that.
Yeah.
But we might want to start working on that.
You also ordered the crib? You ordered the crib this week?
I did. I ordered a crib. So Knox, when we ordered Knox's bed, we talked about my online shopping problem. When I was pregnant with Knox, I ordered his bed and his dresser from Pottery Barn. But I was smart enough at least to have the foresight to order the bed that can be turned into a regular bed.
That's always a good
So
thing.
Knox now has a regular bed that was formerly his crib. Well, it will be a regular bed. I got the same kind.
Yeah, that's something that we actually have to start working on now that we think about it.
We just have to hang up his window coverings because those aren't hung up yet. But we have it all.
Yeah.
But yeah, the only other symptoms, because I know like a lot of the pregnant mamas, they like to listen to the podcast and follow along and feel like their symptoms are normal or whatever. My boobs hurt really bad. Not all the time, but really bad when I'm working out. I think I talked about that last week too.
Yeah.
They just hurt bad. I don't know if it's the movement or the cold air. I don't know exactly what it is, but they hurt. My low back hasn't been bothering me. I think a lot of that was the bed in the hotel that I talked about last week, because my low back was hurting me in the hotel. And we were talking about last night, I'm not really a hungry pregnant lady.
No, that hasn't really kicked in at all much this time around, actually.
No.
Yeah. Like, there's nothing about our eating that has really changed.
At all.
No. Like, even if you weren't pregnant, I think we'd still be maintaining. If anything, you eat a little bit more in the portions, slightly, but that's it.
Yeah, I haven't. I mean, most of the time, I don't even do like the nighttime toast or anything.
No.
So I don't know if, and I was saying last week about like Thanksgiving dinner, there's just not a lot of space in there. But I know I don't know if it's a misconception that I'm just not part of, or if, I don't know. I don't eat that much different when I'm pregnant or more at all than I did before. And that was the same way with Knox.
Because even in the evening, it's hard for you to even finish your food because you're like, oh man.
It's full. It's like uncomfortable.
Yeah, so I think you're doing great.
Yeah. I finally had to go to the, I can't button my jeans all the way up.
Oh, okay.
I have to use like the little like elastic band to hold the button.
Oh.
See, like
yeah, nice.
Like that?
Okay. No, it's not bad.
Yeah, this was the first week for that though. So.
Yeah.
Other than that, we're doing okay. Just still have a lot to figure out and plan.
Oh yeah, of course.
For the birth and everything, but.
Yeah, all those things will be updated.
Yes.
We'll keep you guys updated with everything. But I feel like kind of summarizes week 20. The biggest thing was definitely our anatomy scan, which was really exciting.
It was really cool.
Yeah.
Just be prepared when you go in there for a long time. And, there's a lot of different, little things they're looking for, which I know can seem scary or whatever, but it's just a good time to see your baby.
Yeah, it is. Great. Well, let's just wrap this week up, actually. And that was this week's episode of Adventures of Alcaraz. I'm Julian Alcaraz.
And I'm Miranda Alcaraz.
We'll check in with you guys next week.